Welcome to Understanding Human Anatomy and our continuing discussion of the pelvic cavity. And I want to start looking at the pelvic viscera, and you can see that I'm starting with the diagram we ended with last time, although I have removed the labels because it just gets too cluttered. So if you're in doubt on the structures you're looking at, if you go back to the previous video, it'll have all the labels on it. And we're going to start by talking about the male pelvis. So this is what we left last time with, and there are two openings, one for the urethra and one for the anus. So what I'm going to do is draw in the prostate gland. Here, and let me color that in for you. And of course, the prostate surrounds the urethra, and we're going to have running through the prostate, besides the urethra, two tubes, the ejaculatory ducts. And the ejaculatory ducts are the terminal end of the vas deferens, or the ductus deferens. And let me see if I can color those in. There. Okay, so let me put some labels on here. The prostate gland, and the ejaculatory ducts. And we'll draw a line to the ejaculatory duct here. Now, also opening into the ejaculatory duct are the seminal vesicles. And the seminal vesicles are paired glands that extend laterally and open, as I said, into the ejaculatory duct. There. And the seminal vesicles, along with the prostate, produce most of the fluid of the male ejaculate. And the products of these two glands are to provide nourishment for the sperm and also to neutralize the acidity of the vagina. And we'll draw the label in for the seminal vesicles. Now, as I said, the ejaculatory duct is the terminal end of the ductus deferens. So, let me continue by sketching in the ductus deferens here. And the ductus deferens will enter the pelvic cavity through the deep inguinal ring. And I'll sketch it in on the other side. Like so, and we'll color it in. There. So this is the vas deferens or ductus deferens. Right here. Now, the prostate, the seminal vesicles, and the ejaculatory duct all lie inferior to the urinary bladder. So, next, what I'm going to do is sketch in the urinary bladder so that most of what I've drawn in here right now will be covered over in the diagram. Now the urinary bladder will sit in this position . And we'll color in the urinary bladder. And of course the opening of the urethra will be covered over. Like so. So that this is the urinary bladder. And opening into the urinary bladder are the two ureters. They are descending from each kidney. And I'm going to draw them in here. Like so. And then on this side, and I'm taking pains to draw these in. It's a little more complicated because an important relationship that you need to remember is that the ductus deferens loops over the ureter, so you see that the ductus deferens you see in the foreground in this diagram to the ureter. So I had to draw the ureter in two pieces. So we'll attach a label here to the ureter. There. And everything we're looking at here is retroperitoneal. In other words, everything's deep to the parietal peritoneum. It's all covered by a little bit of parietal peritoneum that forms the floor of the pelvic cavity. Now, the last structure we need to draw into this diagram is the rectum, and I will sketch the rectum in around the anus here. And we'll color that in. And then label it. Like so. So that these are the viscera we'll find in the pelvic cavity of the male. I've exaggerated the space between the urinary bladder and the rectum just to make things a little bit easier to see. Now, I mentioned that these structures are retroperitoneal. We need to look at the folds of the peritoneum in this area. And to do that, it's best to use a mid-sagittal section, because if I drew in the peritoneum on this, I'd just cover everything over. It'd be blanketed. In a sagittal section, we can look at it from the side. So we're going to take and look at a sagittal section that would be cut right along here, a mid-sagittal section, so that we could then view the parietal peritoneum and its folds. Now, as you can see, I've pre-drawn most of this. Actually, I've recycled a previous diagram. And the rectum is shown here. Urinary bladder, the prostate, here's the symphysis pubis. And what I'm going to do is draw in the parietal peritoneum, which would be coming down the surface of the rectum, like so. Doesn't get all the way to the bottom. It then loops over onto the urinary bladder, like so, and from the urinary bladder onto the anterior abdominal wall. So this is the parietal peritoneum. And you can see that there is a low point in the peritoneal cavity, a bottom to the peritoneal cavity. And this is an area between the rectum and the urinary bladder. This is called the rectovesicular pouch. Down in here. And this is the low point in the male pelvic cavity, the low point of the male peritoneal cavity. And if one develops an infection in the peritoneum, so that fluid accumulates in the peritoneal cavity, it will settle down into this pouch. So if one does surgery and wants to check for peritonitis following the surgery, a drain is set down into this pouch and brought to the outside, and so that you can collect any material that forms here and thus see if an infection is going on, if the patient has developed peritonitis. So, that concludes our discussion of the male pelvic cavity. In the next video, we'll discuss the viscera of the female pelvic cavity. Thank you for your attention.